that second actually is, but you'll probably get a notification. There we go. Welcome everyone to day 26 of Thriving in the Face of Cancer. I'm your host, Chef AJ, and every day for 5 more days now, I will be talking to top doctors, other healthcare professionals, and people who have survived cancer, who are going through cancer, who are going to give you insights on how you too can thrive even in the face of cancer. My guests today are Brian and Jessica Krock from Krocks in the Kitchen, and they're going to share their story with you. Please welcome them to the show. Hello, Krocks in the Kitchen. It's so great to see you.
Hello, here we are.
Well, you guys have quite the story. You have double the story now. Even I mean, we could have just had either one of you on, but no, we get 2 for the price of 1. And we can start anywhere you like with your stories because you both have or had cancer. And first thing I just want to say is I apologize for not being like more of a better friend. I wanted to reach out to you guys so many times, and I just like I did like. Do you want people to like reach? Like, I don't know how to do cancer either as the friend of somebody with cancer or the person that has it. Like, they don't give you a handbook, you know? And I thought about you all the time. I followed you, but you were diagnosed about 2 months before me. And I just, at that point, I hadn't come forward, and I appreciated your bravery. Like, I'm like watching you and I'm like, this is somebody who says she has anxiety, and she's like I kind of modeled myself after you in a way, you know?
Yeah, I will say that there is no playbook for dealing with cancer really, uh, and like I know me personally, I get to the point where I understand that other people are going through things, but I also feel that like if I reach out to them, that I'm putting more on them, like I'm taking up their time and like that kind of thing. So totally understand you not messaging or any like, and you did message us occasionally but like through certain things, and but yeah, like totally understand, no problems whatsoever.
Honestly, like when you sent us this amazing box of California balsamic, I was like, oh my gosh, this is that. Like, I still remember that. And I'm like, it was just a nice gesture because you don't know what to say during those times. And I think that the biggest thing that I've learned going through what I have is that there's really nothing you can say to somebody that has cancer other than, yeah, this sucks. Like, that's the only thing, because so many things that you say to people who have cancer, you're trying to like, you're trying to be nice, but you're almost like you can devalue their, like, you make it so that it's like, oh, it's not a big deal, you're going to be fine, and then that makes the person with cancer think like, oh, okay, like it's not that big of a deal, why am I, being so, why am I so worried about it?
Yeah.
So it's kind of, there's just, it's really hard. But I would say, like, to anybody out there who knows somebody going through cancer, the best thing honestly to say is, this sucks and I'm here for you any
Yeah.
way you need me, because it sucks.
Yeah.
um I also wanted to say, before we like get into our story, I just wanted to say how proud of you we are for everything that you've done, opening up about it. I know, like, you had reached out to us, I don't even remember when it was, but it was quite a long time ago. You had reached out to us, and specifically had asked me about going through it with anxiety and all of that. And I know we had exchanged some conversations, and I know that you were asking us, advice about going public with it. And we were just sort of like, we didn't really know what to say, because we knew that like 99% of what you get back is going to be positive, but you're always going to have those people who are going to hate on you and all that. And then you're going to get so much advice that it's like, for someone with anxiety, that talk about like,
Yeah, we had to put a stop to, not a stop to, but Jessica stopped reading comments, and I was the gatekeeper of all comments at that point, because I could emotionally handle it, and I could switch off like that part of my brain and just be like, and start categorizing, be like, is this solid information, is this weak information, how do I research this, where do I find this at, break it all down, and then eventually come to a conclusion on what it is. And it did, some people did comment stuff that I ended up asking Jessica's oncologist about, people who had gone through the exact same situations or something of that sort. And so like, yeah, it's it's a wild time whenever you finally tell people, because then it's like you never really know how people are going to react, but you kind of get that look on their face of just like, oh, like, I'm sorry, like, and they don't really know what to say. It's like telling them that like your parents died or something. Yeah, it's like,
Yeah. But I can't imagine like the amount of weight that was lifted off of you when you did finally.
Oh my God. It just was unbelievable because I had kept it in for like 2.5 years. And it's funny, when I was at the True North Health Center for doing my second water fast to try to shrink the tumors last October, I had some consultations with clergy, and I'm technically Jewish. And that's the reason I sent you vinegars, because that's what we do in Jewish people. We don't know what to do or say. We just send food, that's our thing. And so I had a consultation with a Presbyterian minister, because there was a church across the street, and a Catholic priest. And they both said that my secret was keeping me sick and preventing me from healing. And that's when I decided to go public. And like Brian said, I stopped reading comments. I had to. So I hired somebody. Her name is Linda. And if there's something really nice, she'll send it to me. And if there's something not nice, I don't see it. That was the only way I could do it. Kind of like Johnny Depp, who apparently doesn't watch his own films after he makes them.
Yeah. So yeah, I guess, yeah. So definitely wanted to make sure you knew we are so proud of you for everything that you've done. I feel like when you start, and you probably already have, getting back, you'll get back comments of people saying, I did something, I knew there was something wrong with me and I did something about it because I heard you sharing your story. Like, just all of that you'll get back is so crazy. And the fact that you're on here, bringing everybody together and sharing and bringing a light to really like the anxiety side of it is a huge thing that nobody really talks about, I feel like. And even still in, today, where mental health is so much more prevalent in conversation, bringing light to that is just such a big deal, because it's a huge part of it that no one really talks about.
Well, that's been the hard part for me. So I want to ask. Well, Brian seems like he's a fairly calm guy, but how have
it's
you
all a facade.
how been able to manage it is what I want to know. And one thing before I forget. So I've watched a lot of your videos, most of them, and I watched the most recent one. And one thing I want to say, and I hope you'll hear this because it kind of made me sad. You guys were talking about like, the diet and like, should you be more compliant or whatever. I've been perfect for 20 years and I still got cancer. Okay. I've been vegan for almost 50 years. I've been gold hammer perfect for 20 years. I did not step out of line. I still have stage 3 lung cancer. So please don't beat yourself up about your diet, because there are so many reasons that people get cancer. And, so I just hope you know that, so I don't want you to feel bad for that reason.
Yeah, I think I might have touched on it in our last video though, about the two-hit hypothesis, that basically you could have your same life run completely identical 100 different times, doing the exact same things, and only one of those lives will get cancer. It's just because the right things came into right alignment at the wrong time and caused the cancer to start like growing in the first place. One little cell got switched, and boom, here we are now in the exclusive cancer club.
Yeah, and I think the important thing, and it made me so sad when I heard you talking about the fact that people told you not to go public with it because it would make, veganism or plant-based or whatever look bad. Like, that made me so sad to hear, because here's the thing. It's not about, like, we can be perfect. Like you said, you could have been perfect since the day you were born sticking to this and still gotten cancer. But it's about, to me, it's about, let's get ourselves to the healthiest place that we can and do the things that we know are healthy for our body, so that if we are faced with these situations, our body is better equipped to handle them. And I can guarantee you, like, eating the way that we, when we started in 2018,
Yep.
up until, like, for most of my life, I ate like total crap. And then, in 2018, I started getting it together. And we obviously, if you have anybody out there who has watched our channel, Krocks in the Kitchen on YouTube, you'll see that we are like not the perfect role models of plant-based diet to go off of, but we keep trying. But I can only imagine where I'd been if I'd stuck to eating, the sad diet, standard American diet, for that entire time, and then found out I had cancer. And it's just another tool in the toolbox that can help you but it's not gonna, it's not a foolproof. That's what people don't understand is like, they're like, oh, well, you started eating this way and then you got cancer. Well, it's like, yeah, but I also have a lot of other years of eating really bad stuff.
And I think a lot of that also comes from the fact that people who will say things like that, they want to believe they have control. They want to believe like they can do a specific XYZ and get a certain outcome when it comes to their body or life or whatever it happens to be. And in reality, you don't. Control is an illusion, and if you keep thinking that if I do everything perfectly, I'm not going to get whatever this is, then you're just going to spend most of your life, struggling just to stay alive. You know?
And now that being said, do I sit awake at night and think like, is both of us, being like getting to the point where we're so obese? Did that contribute to us getting cancer? And is that, if we hadn't done that, like, would we not have gotten cancer? Yeah, I'll still think about that. But at the same time, I can't control that, but I can control what I do going forward. And I think like what we were talking about in the last video is about that too. It's like, we need to do better going forward. And we know that, and we'll always keep trying. But it's hard. It's really, really hard.
Yeah, absolutely. So I assume that my audience knows you, but people will find this video and maybe they haven't heard your story. So let's start with you because we'll go in chronological order. If I remember your story correctly, you were actually having pain. So
yes.
And what I've been learning from a lot of the cancer support groups I'm in is that very often, if you have cancer, pain is not always a symptom of cancer until it's advanced. And so yours, tell the story.
Okay, so the story really starts in May of 2022. And just before that, just so everyone in your audience knows as well, in June of 2018 is when Brian and I were like, we've had enough. We've been overweight our entire lives. We've tried everything to lose weight, and we got turned on to a whole food plant-based diet. So we've been doing that for several years, and we shared that on our YouTube channel, all our ups and downs, and we made great recipes and all kinds of stuff. And then in 2022, starting in May, is when everything kind of went crazy. So Brian one day came home from church and was like, I want to get a bike. And I was like, today? And he said, it was spring. He said he'd been talking about getting a bike forever, like wanting to ride a bike and all that. He wants to relive his childhood riding a bike around, we're living in where he grew up. So he said, the statement you said that day was, if I don't do it today, I feel like I'm never going to do it. Getting a bike. Okay, cool. So we got a bike. We even made a video about it. We were like, let's film a video about us getting bikes and it'll be fun. So we go to the bike store and I was like, well, if you're getting a bike, I need a bike, right? So we start riding those bikes over the next week. And that's when I started having this pain. Everything was fine and normal before then. There was absolutely no pain or anything. I started having this pain on my left side, like left lower, like, I don't know, what you call like abdomen. Yeah. And everyone said, oh, well, you just started riding a bike again. You haven't ridden a bike in like 15 years.
And you did have that small fall.
And I had a little fall, but it was like a slow-mo, like going up a hill, and I didn't know how to pedal properly, and I like tipped over fall. And so everyone's like, oh, well, you probably just pulled a muscle, whatever. So I said to myself, and I remember we were actually at a meeting of a plant-based group that we had in St. Louis, Plant Powered St. Louis. We were at a dinner with them. And I said to myself at that dinner, I said, you know what? If I still have this pain by next Monday, I'm going to the doctor. And I still had the pain, and I had made an appointment with my nurse practitioner at my doctor's office, went in, and luckily they weren't on the drive there, which I started filming because I thought I had a kidney stone. And I was like, oh, this will be another interesting, like, does a plant-based diet make you have kidney stones? I don't know, like, whatever. Like, it would be interesting to find out, like, how's this going to go? So I literally started filming right before I set off for the doctor's. I started filming a video, like, okay. And on the way to the doctor's office, I remember thinking, this is stupid. I probably have pulled a muscle. I probably have gas or something like that. And I'm wasting everybody's time going to the doctor. I go to the nurse practitioner, and she is very thorough. She's like up and down, like, could it be this? Could it be this? Could it be this? And after being with her for an hour and her like going back and forth and consulting with my primary care physician, she said, let's have you get an ultrasound. And I said, okay, cool. So we're going to do an ultrasound and figure out if there's something going on in there, great. So it was like maybe a week later, the ultrasound happened. Brian and I were actually on our way to Albuquerque, New Mexico. We were going to drive there from St. Louis. And we scheduled the ultrasound in the morning, and then we were hitting the road. So I got the ultrasound done, and on the way, we were literally stuck on the side of the road because we ran out of gas somewhere in Oklahoma when we got the results back that said there was some kind of, did they call it a mass at that point?
Yeah, it was a mass.
A mass in my ovary. And I'm like, okay, I've been told that it's, like a very, like, it's going to be like even in the report. And when they talk to me, they're like, it's probably just like, these are very normal, like cysts or whatever in your ovaries.
Tumors on the ovary are a fairly common
super
thing.
normal. I was 36 at the time. We went to Albuquerque. We had an amazing time. I'm like a huge Breaking Bad, and Better Call Saul is my favorite show. So we had an amazing time. Like,
we went to an improv show that he hosted.
Yes.
So it was Bob Odenkirk hosting an improv show in Albuquerque, New Mexico. And it was hilarious.
With Ray Seahorn.
Yeah, with Ray Seahorn, who's
so
on
good.
Better Call Saul.
It was so good.
Improv is my life. That's the thing. One thing I changed when I got cancer is just doing what I love. I don't know if you guys did that. And that's like my favorite thing in the world. And that's all I do.
So we went, we had a really good time, and we didn't think too much about. But meanwhile, I was on the phone with my doctor. Like, I remember I went to go get my nails done. I remember all these so specific details. I went to go get my nails done at the nail salon that they use on Better Call Saul as like his office that he goes through. People who watch the show will know what I'm talking about, but it's the nail salon. I got like turquoise nails. I was super excited. I got a call from my doctor's office, and they were like, oh, we want to do, what did they want to do? Oh, they were going to get me scheduled to have this thing removed, basically. Yep. So it was going to be a minimally invasive surgery that they were going to have me scheduled for to have this thing removed. And I was, get on the phone trying to get doctor's appointments set up and all that kind of stuff. And when we were still in Albuquerque, drove home, whatever, went and met with the doctor, decided, yep, the minimally invasive surgery to get this mass out would be perfect, like the best plan, because even if it's not cancer, because the doctor was like, you're so young, it could be this. I remember her going with her hands, it could be this, it could be this, it could be this. Cancers are like the lowest thing on the list it could possibly be. I'm like, okay. So I wasn't really too worried about it. I'm going to have the surgery. I've had, my gallbladder taken out. Like, I'm like, sure, whatever. Then going into, it was like, Memorial Day weekend and Memorial Day, that it was like May 30th or whatever of that year. I was in so much pain. Like, just the amount of pain that I was in was insane. And I told Brian like to drive me to the emergency room.
Yep.
Are you okay?
Yeah, I just had a little flashback to being in your hospital room and looking out the window as the jets were flying by, and just, thinking of happier times before I was sitting in a hospital with my wife in a hospital bed next to me.
So yeah, basically I end up in the hospital. I am in the ER. I threw up on the way to the hospital.
Yeah.
Which I like hate throwing up.
She has what's called a vasovagal reaction, which means she passes out when she throws up. Although this time you did not.
I did not. But I remember throwing up into one of those giant bags they gave us at the drive-in theater that we'd been to sometime the year before that I happened to have tucked away in the car. Anyway, all the little things that you remember about these times. So we went to the hospital and got checked into the ER, and they gave me some morphine.
Yeah.
It was nice.
I've never had morphine.
It was, I had been in pain for so long, like at that point for so many weeks, that this pain had kept building, that by the time I got to the hospital and they made the pain go away, even for a second, it was just amazing.
She was so happy. She sang a little song. It went, drugs are good.
Oh my gosh.
Drugs are great. Give me more drugs.
I'm horrible. Anyway, shut up. Okay. So Okay, so I ended up getting checked into the hospital. It was weird because when I was in the ER, like they kind of were like, all of a sudden they had like a gynecologic oncologist involved in the whole thing.
Mm-hmm.
And they were going to do the surgery, but they were like, oh, just because it's oncologist, that doesn't mean that it's cancer. But there's something they saw on the CT scan that was a little bit like, I don't know. And like, but they were still just like, oh,
Yeah,
it's probably not
yeah,
cancer.
even they were like, no, it's like cancer's way down on the list of what this possibly could
You're
be.
36, young. Okay. So I get checked into the hospital, and they actually were like, I was in the hospital for a few days. They said I could go home and then come back or stay in. And I was like, I'm staying because I'm in so much pain. And they were just basically trying to get me scheduled in for the surgery. And was it June 3rd? They did the surgery. I think it was a Friday. I don't know. But, and they had told me that if I had cancer, the way that I would find out would be Brian would tell me when I woke up, which I thought was a little weird, but okay. So I woke up from the surgery.
And you asked, do I have cancer? And I said, just get some rest.
And that's when I knew.
And then
I had cancer.
Yep.
And it was just,
I will never forget the look on your face.
And the surgery,
as long as I live.
And during the surgery, it took tell about them.
It was supposed to be like a couple hours for surgery or something like that, and it ended up taking almost twice as long.
Yeah.
And I'm sitting there in like the waiting room with my mom, who my mom is a breast cancer survivor, and so she knew. She's like, Brian does not need to sit there alone for several hours waiting to possibly hear horrible news. And so like she went and sat by my side and just, was a great comfort to me. And I was watching on the screen as like, still in surgery. And I'm like, they said it was going to be over by now. And it wasn't. And then finally, the doctor comes out and she's like, okay, so everything went great. Everything was blah, 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 blah. And I'm like, okay, cool. And she goes, so it is cancer. And I'm like, you got to be kidding me.
Those are like the worst words you can hear. At that time, what type of cancer did they diagnose you with and what stage was it?
So here's the thing. They didn't actually know if it was ovarian, uterine, or what was the third one that it could have been? I don't even remember. Cervical.
Yeah.
So they thought it was one of those. So I guess staging wise, I don't think they told us anything.
I asked and she said, if I had to stage it, she's like, I would stage it at 3.
So what had happened, the reason I was in so much pain was because this mass, which was about the size of a tennis ball, had basically overtaken my ovary on the left side. And it had started to grow around like my ureter, which is the line that's between your kidney and bladder. So it kind of was like that's kind of the reason I think we got to kidney stones as potentially what was going on, because it was very similar to that pain because it was blocking it off. And basically I had like fluid, the fluid backing up into my kidney, and it was like
hydronephrosis.
I can never say that word.
Hydronephrosis.
And so it had also kind of like grown up against my bowel, like it was touching the like line, like outer, just touching it. It was I don't remember exactly 100% like all the things, but apparently that surgery was quite it was like, they think they're going in to take out an ovary and the fallopian tube or whatever, and they are like, trying to get the cancer off of all these different areas and everything like that. It was a whole thing. So they didn't actually, so it took forever for my pathology to come back. Like it was
a couple weeks,
several weeks before the pathology came back, and it felt like forever. So finally we got the news back, and they actually thought it was a neuroendocrine tumor in crossing ovarian, and that it was ovarian.
Yeah, an ovarian neuroendocrine cancer.
The crossing ovarian with neuroendocrine is like, that's like,
yeah, there's only like 40 documented cases of that.
It would be very, very
in the
rare.
literature.
So also what happened when I was in the hospital is we discovered that the surgeon who did surgery on me was not in my insurance network. And this is a hospital that I go to for everything that I've done. Like all my doctors are at this hospital, but for whatever reason, the gynecologic oncology team, there's 2 of them that were there at the time. Neither of them was covered by my insurance. And it was all fine because I had gone in through the ER. So everything got, it was mostly covered. Like I had to pay like, obviously, thousands of dollars and whatever, but it wasn't crazy. Like, oh, this is not covered at all, but but they were basically like, okay, you have to find someone else to, proceed to be your doctor and proceed with your treatment and figure out what you're going to do. You have to find a different oncologist. They gave me a list of like, I don't know, 7 or 8 names of people who are in my network in St. Louis area. And, we're just like, okay. So after 12 days in the hospital, we go home and I'm just like, I don't have a doctor to follow up with. Like I have the one follow-up appointment to go over the pathology with that doctor because they did allow that appointment. But after that, I'm like kind of on my own to figure out what to do. So we went back and forth for a while. And like during those few weeks, we were waiting for the pathology and all that. And then when we got the pathology and it was like, oh, it's this neuroendocrine ovarian, like what a craziness. And there was actually 2 different types of cancer. There was also a very small, like stage 1A, like very, very start of a polyp that they found that was cancer in my uterus. So I had actually 2 different kinds of cancer going on. And it wasn't the spread. They said it wasn't the spread of that cancer. It was like a totally separate cancer. And we're just like, okay. So we had happened to be in Rochester, Minnesota in March of that year. We rented an Airbnb up there actually to film a bunch of recipe videos. And the only reason we picked Rochester, Minnesota was because we were like looking for an Airbnb with a kitchen that we wanted to film in. And we really wanted to go in and film like a bunch of videos and get it all done. And we really like this kitchen in this Airbnb. And so we're like, okay, Rochester, like Mayo Clinic's supposed to be one of the best, if not the best in the world. And so it's only like a 7-hour drive from us. So we're like, you know what, let's just call them up and see if we can get in there and get a second opinion on this very rare thing that they're diagnosing me with. And so eventually we went up there and they actually redid my pathology. They got like the slides mailed to them from my original hospital and all that stuff. And they actually did not believe it was neuroendocrine. They believed it was ovarian cancer. And then also uterine cancer in that like polyp in my uterus. So 2 different types. And for the ovarian cancer, it was stage 3 because it had already advanced regionally into like different areas. Then they did another CT scan and they're like, wait a minute, there's also this stuff in your liver. Did they not see that before? And I'm just like, my original CT scans at my hospital don't show anything with my liver.
Nope.
But the quality also at my home hospital was nothing compared to what like Mayo Clinic has. So then they thought I had stage 4 and it had already spread to my liver. And there was also a bunch of lymph nodes that were very concerning. And so the plan ended up being like, okay, the standard, what do you call it? The gold, what do you like to call it? Something else.
The standard of scare. The
standard of scare.
Yeah.
The standard of scare. Okay. So the standard for ovarian cancer is to go through like 6 rounds of chemo, and it's oh God, I've blocked all this out of my head. Paclitaxel and carboplatin.
Yeah,
I don't know,
something like that.
The name sounds so scary that
There's
it's just
2 different chemotherapy drugs.
Yeah, 2 different chemotherapy drugs, and that's kind of like the first round of attack. Although like I'd already had surgery, so it was kind of like, normally I guess maybe they would do the chemo, try to shrink things, then do the surgery, but I'd already had the surgery, so it was like, okay, let's just do the chemo to kind of clean up if there's anything else in there that is cancer, and also what the heck's going on in your liver, we don't know. It was like a very confused, like I stumped the Mayo Clinic. Like they were so like great about figuring it out. They had so many tumor boards talking about my case. They had all this stuff, but they could not, to this day, like we still really don't know what the heck happened. But I remember when I was still in the hospital before I'd gone home, my original hospital at home, we consulted with some very close friends in the plant-based world about like, what the heck do I do? And we talked about like, you know, obviously like an eating, like getting super, super clean with the eating and everything like that. Which I did do throughout like all of my treatment and everything like that. I was very, very strict about everything plant-based, like whole food plant-based. But I remember one thing I remember sticking out to me, and it was actually Nelson Campbell who said it, was just don't let them like keep giving you chemo. Like don't let them, you know, ask questions, be very like, you know, like ask questions about everything that they're going to do and everything, you know, don't just sit there and
don't just accept it,
the treatment and just keep going with it, you know, ask the questions. And so when they wanted to do chemo, I was a little bit like hesitant, but I also just didn't know what else to do. So I was just like, I mean, we were pretty much just like, okay, that's what I need to do, right? We just did it.
Yeah.
So they did the 6 rounds of chemo that went from into like late December of 2022. I lost my hair. And here's the funny part. Everyone talks about the hair. Like you say you're going to do chemo and you're going to lose your hair. Losing my hair was like the least of my worries. It was actually kind of fun to be bald. And I actually kind of want to shave my head again. So anyway,
but you're so calm, Jessica. Like, I mean, when you were first having just the pain, were you thinking at that time this could be cancer?
Oh, of course.
Oh, yeah.
My brain is trained to go to doomsday scenario. So like,
so you're not, I think everybody's anxiety is different, and mine is all around medical stuff. Like I had to go to a pedodentist till I was almost 50 and have nitrous oxide just to get my teeth clean. But you weren't even afraid of like having that initial surgery. You just, you know?
No, the surgery and all that didn't scare me. Yeah, it didn't. I just wanted the pain. I was in so much pain. I just wanted the pain to go away. And so maybe that's also why, like, you know, in your case, I know like you hadn't, you know, like it was just found incidentally, and there wasn't like this alarming, like I have this pain, and it's, I mean, I was in so much pain and like nauseous and all kinds of things. Like they think my ovary was probably like doing like ovarian torsion, like twisting on itself, which causes a lot of, it just, I mean, I was just like, let's do anything we can to get this pain away going into that initial surgery. And also they had just told me that it was so unlikely that it would be cancer, that it was just like, okay, cool. Like it's going to be fine. You know, it's going to be, they're going to take this out. I'm going to heal. I've done that before. Like I've had my gallbladder out. Like I said, you know, it's like none of that really scared me. But after, like everything just changed after they said that I had cancer. And it was just like, yeah, I was terrified. The good thing was I had dealt with so much of my anxiety years prior and gotten such a better handle on my anxiety. If I hadn't done that and I was still struggling like I was for most of my life, I don't know how I would have handled it. And then I also had this. He is you. He is
no, like, he seems like such a calm, stable support husband.
He's the calm to my storm. Like I am like a hot mess, and he is just like so calm in all of that. And so I had there was a lot of moments during those early days finding out, like, and I can't watch like those videos that there's videos of us going through all that in the very beginning, because I'm sitting in the hospital bed and I'm like, I was in the hospital for 12 days. I'm like bored out of my mind. And I'm like, okay, let's just film some stuff. Like might as well. And so there's so much of that I just can't watch now because it's just,
we can't watch those videos.
It's so hard. And I was terrified in those initial days, but I was also like, okay, I have to figure out a plan of attack and figure out what I'm going to do next and what my next move is going to be. And, you know, after we went up to Mayo Clinic, we just felt so good about doing, you know, treatment up there that we just sort of like stuck with it. So I'm still a patient. I'm still doing all my stuff up there to this day.
Yeah. I did also want to say though that, Jessica saw the calm. She saw me being the pillar that I try to be, the husband that I try to be. But my parents, they saw me as their kid who, was crying his eyes out, having to deal with the fact that my wife has cancer. My friends, my church family, they all saw me when I was down, when I didn't feel like standing up. But Jessica, she only saw the rock star,
Yeah,
and that was very,
Yeah.
very deliberate.
No,
I wasn't going to put
I'm going to say the Croc star.
the rock star.
he has this ability to sort of, and we've had to work on it over the years, to bury his, like, if he does have anxiety or any issues going on, like, bury it, because for so many years of our marriage, like, we've been married for, like, it'll be 14 years in November. For so much of our marriage, I was the one who was just so anxious about everything that he felt like he needed to hide things, not bad things, but like if he felt like there's any kind of medical issue going on with himself, like he would just be like, not really open with me about it because he didn't think I could handle it. And so I've had to tell him over the years, now that I'm so much better with the anxiety, like I can handle it. Like, but during that time, obviously, it was a totally different story. So, yeah.
I almost want to say the fact that you went through this cancer experience, you almost can handle anything now.
Oh, yeah.
Oh,
well,
yeah.
yeah. Now it's like, and I think that I feel like that came up on one of your videos that we were watching recently. It was like, now that I've been diagnosed with cancer, it's like, there's no, what else are you going to bring at me, world? Like,
that's one of the reasons I was able to go public, because I know there was like 7 people that made videos about me. I didn't see them, but I heard who they were so that I could take them off my Christmas gift list. But it was like, what could they possibly say or do to me that's worse than having cancer? So, hit me with your best shot.
Exactly. It's like, hey, I already am in the worst,
Yeah. Like it kind of does give you a real big sense of invulnerability. It's like you have no power to control my life now.
So just to wrap up, like kind of what happened with me. So I went through the chemo. Chemo is awful. Chemo sucks. Chemo made it, and it wasn't about, you hear about chemo, you hear you lost your hair, you hear you got nauseous, you threw up, you whatever. The mental effects it had on my brain, I felt like an alien. I felt like so weird in my own body. I felt it put me in what Brian called the pit of despair. The pit of it made
it wasn't depression, it was despair. It was a complete sense of hopelessness. And I mean, I could just see it on her face every time.
Absolutely nothing. And when I did the chemo, and it was like every time I did it, like I'd have a good day after, the one day after it would be good. So we tried to do something fun that day. And then Brian could see me digging into the pit, and then I'd reach the bottom, and then, you'd start to climb back out of it. And then it was time for another round of chemo. But there's nothing anyone could say to me when I was in that pit that made it feel any better. I had people, very, very, very good friends, even a friend who had gone through the same exact chemo regimen as me, telling me, I promise it will get better. You will get to the other side of it. You will feel normal again. There will be a time when you're sitting back on this and you will feel totally normal again. I mean, normal for what normal is now. Normal is not the same as it was at all a few years ago, but you won't feel this way, this pit of despair. And nothing they could say. Logically, I knew, like, oh, these people done it, and they're saying like you'll get through it, but didn't matter. There's nothing anybody could say to me to make it any better or make me feel like it was going to ever get any better. It was awful. There's people who go through just rounds and rounds and rounds of chemo. We lost a very, very dear friend of ours. It's almost been a year ago now, who just, she went through so much chemo, and I have no idea how she had the strength to keep, and she was fighting for, for her life, and she, her days were numbered. She knew it. And it was just like, anyway.
I also just wanted, last year, we lost 3 friends to cancer, 3 women, and they were all named Jen.
Yeah, they
And-
all were named Jennifer.
and,
Three different, totally different stories.
Three totally different stories, three totally different types of cancer. Yeah, last year was
Yeah.
not good.
But okay, so I went through the chemo, got through it. It ended in December of 2022. And then there was this big wave of uncertainty. And as you've learned, AJ, all about like there's a certain protocol. It's like, well, you can't just do surgery, or you can't just do, XYZ, like, or if your cancer is metastasized, in my case, which they thought still that it had metastasized to some lymph nodes and liver. So they thought I was stage 4 at this point. The chemo showed like, I guess some changes, but nothing like, I don't know. I mean, did it really like,
well, because the original surgeon had done such a fantastic job that like the chemo was basically there to clean up. Yeah. It was there to kill any cells that may be sticking around and all that. But the surgeon at Jessica's at the hospital was she was really, really good.
Very good.
In fact, the surgeon at Mayo even said so to us. She's like, your first surgeon did an amazing job. And I was like, cool. So if I ever see her again, I'll tell her.
So over Christmas, nevertheless, which Christmas is my favorite time of year. Over Christmas of 2022, going into early 2023, we're in this limbo of like, am I going to have surgery or am I not? If it's already in my liver and my lymph nodes, the standard, like doing which the surgery on the docket would be like full hysterectomy, remove the other ovary, remove my omentum, remove like anything that is, down there that could potentially like, I mean, I still had this other polyp that was in my uterus. So it's like, I mean, they took that out during the surgery, but like, let's just get rid of all that stuff. And I'm just like, yes, let's get it all out. Like anything down there that looks like it could have once talked to a cancer cell, get it out. But if I was already in stage 4 and it already spread to my liver and my lymph nodes, then doing the surgery wasn't really like on the table, which doesn't really, it's very confusing to people outside of cancer world, but like sometimes getting to a point where they'll do surgery on you is a good thing. Because it means they think they can still kind of like cure you of the cancer or like, get rid of whatever. So I had to actually, the original surgeon that we met with didn't want to do the surgery. The liver doctors did a whole liver tumor board about my tumors and was like, it's definitely in her liver and all this stuff. But the head of gynecologic oncology at Mayo Clinic was like, no, this girl is 36. Well, I was 37 by then. She's so young. We've done I had done biopsies and none of the biopsy on my liver was inconclusive. It did not find cancer.
It found keratin granuloma.
Yeah, keratin granulomas. And I had all these things I come from Missouri. My home state is Missouri. That's the show me state. And I'm like, you need to prove to me that this cancer is in my liver. Like until you prove to me that there is a cancer cell in my liver, I do not believe that there is cancer in my liver. And Brian was very, very big about that. He was like speaking like, no, you do not.
Oh yeah. I don't care. I didn't care if they were doctors at Mayo Clinic or not. I'm like, show me evidence.
Yeah.
Like you guys are all scientific minded. Show me evidence that it's in her liver.
It's like, we know the scans look bad.
Actually cancer in her liver.
Yeah. We know.
What did what did the head of gynecologic oncology say? The only person who can say it's cancer is pathology. She's like, I can't say it. The other doctors can't say it. Only pathology can determine if you have cancer or not.
Yeah. It looks bad from the scans and everything, but it's like, we were just like, and sometimes I thought, are we just in this weird dream world of like, are we just like, I don't know. Are we being stupid here and not believing them? Anyway,
we took Nelson's advice to heart though, and we kept asking questions and we kept trying to advocate. We kept trying to find answers.
Yes. So we actually had to like have the doctors kind of like go not behind each other's backs, but there
was some drama.
Apparently we caused some drama at Mayo Clinic.
And apparently the drama is still continuing.
Yeah. So. Even 2 years later, the drama is not like 100% gone. We just recently learned and we're like, oh, okay. But anyway, so I ended up getting the surgery January 16th, 2023. So it's been just over 2 years ago. They removed everything, like I said, full hysterectomy, the other ovary, my omentum, my
Cervix,
uterus,
yeah.
my,
or not cervix, you know what I mean.
I don't know, all the things. They took out 57 of my lymph nodes. So any of the lymph nodes that looked at all suspicious, anything like that. And what did they come tell you when I was in it was a 9-hour surgery.
Yeah. So the surgeon called me, and she was like, she basically was like, we went in, and you know, he's like, we took out everything, like anything that even looked remotely suspicious, we took it out. She goes, and then she told pathology to go over it with a fine-tooth comb. She's like, I want you to absolutely check every single thing that you possibly can. And when they came back with the actual pathology report, they said that not only did they not find cancer, they didn't find dead cancer either. So all these things that they thought were cancer turned out to not be cancer. And all they found were keratin granulomas.
Yeah.
So did you need the operation then, or?
So that's a good question. So a lot of people ask that, and in my head, I'm glad that I had it because I feel like it definitely decreased the risk of like recurrence. You know, considering it was already stage 3, and like I feel like it was good to get it out.
And the other option, the other thing too, was that recently your oncologist said that it was great that we did it because it gave us answers. Like, had we not done that, then they would have probably just kept going like, well, we see these little things, let's keep giving her chemo and like trying to treat this and blah, blah, blah. But instead they did the surgery. We got answers to what was actually going on in there.
Yeah.
Yes, it was painful, and the recovery was pretty brutal.
Yeah.
Especially getting shoved right into menopause.
Yeah.
But
like post-menopause, it was like, yes. I'm not even going through menopause. It was like, oh, now you're just post-menopause.
Yeah.
So that was fun. But yeah, he said that it was absolutely, the doctor we met with just recently, like a few weeks ago, said it was absolutely, looking back at everything, it was absolutely the right decision to do the surgery, and that, you know, it gave us answers. And I think that's what Brian and I wanted, was proof and answers. And the surgeon looked at my liver when she was in there, and she's like, I didn't see anything concerning on the liver. And like, in my scans now, there's nothing on the liver, and she didn't take anything off the liver. So it's like, my main doctor there, like told us, like, we learned a lot from from everything we went through with your case, because it's just, they're trained to just assume that it's cancer. And like, they learned, you know, hey,
there are other answers.
And I can't tell you how many times we were just like, but how do you know it's cancer? And they were just like, well, it just, you know, looks this way or that way. And we're like, but
did you get any PET scans?
Yes,
did have one.
I did have one PET scan. So PET scans are not actually like the kind of like norm for ovarian cancer. They
only use PET scans for cancers that aren't in the like brain, kidney, liver, or a couple of other spots too, because all that stuff glows anyway. If you look at the PET scan, your liver glows, your kidneys glow, your brain glows, because they're all using glucose.
I see. So for those that use MRIs, that's why, because I get a combination.
Yep.
Oh, very interesting.
CT or MRI.
I've had MRI. I've had MRIs done. I've had, I did have a PET scan done, and it was everything that they did was always just like, we were hoping to get like, okay, this is what it is, and this is what we need to do. And it was all like so inconclusive that by the time we got to the point of doing the surgery, I was like, yes, please open me up and get in there and actually see what the heck is going on. Take these lymph nodes out, take this stuff out. Like,
wow.
And I liken it to the analogy of like, sometimes you need to destroy the forest to stop it from burning. And so that's kind of what that surgery was. They knew where the cancer was before, they knew what it had done. And so they were like, if we remove all the other stuff, then there's less of a chance that it's, little embers are flying off into other places.
Yeah. Now, that being said, I was also
theoretically
I was
speaking.
also in a very fortunate position. I was 30, by the time they did the surgery, 37 years old, which the average diagnosis of ovarian cancer is like age is like 67 or something.
Yeah.
So I was in a position where, I was relatively healthy, didn't have any major health issues other than, the cancer, obviously. But I do think about like if this happened to somebody like twice my age, and then they're like, okay, we need to do this surgery, or we think that there's cancer in there and we need to give you chemo, and then they just keep giving them chemo and chemo and chemo and chemo. And then it's like, how do they know? Like, if in my case it wasn't really cancer, even when I was watching your video where you're talking about because yours is like metastasized to where?
Bronchial lymph node.
Lymph node. It's like, well, how do they know that that's actually cancer? You know what I mean? Like, it's just, I'm very suspicious. I will say the thing. So to wrap up what happened to me, surgery, there's no more cancer. They couldn't find anything, whatever. I'm put on a schedule of every 3 to 4 months. I get a CT scan. They look, they've seen a couple weird things with my lymph nodes here and there, but nothing like alarmingly crazy to them. But I just continue to be no evidence of disease. People are like, are you in remission? Are you cured?
They
Are
don't
you
say
cured?
remission.
Are you whatever? And I'm like, I don't use any of those words. I just say, right now, there's no evidence of disease in my body. That's what I'll continue to do until and there's no treatment, no additional treatment needed for me after the surgery. It was just recover from the surgery and let's keep checking and see if anything comes back. And that's kind of where I'm at. But what I will say, what I learned throughout this and what I stress to people is ask questions, advocate, listen to your body. Like, the pain that I was having, I thought it was like, to think back and think that I thought I was stupid for going to the nurse practitioner and wasting their time with my original appointment. Like, what a joke. Yeah, go ask the questions. If they won't do scans, if they're like, no, you're just having gas or you're just whatever, get to somebody who will get you the scans. There's too many people out there. Like, my cousin, who is like my best friend, her neighbor passed away because at 30 of stage 4 colon cancer, because they wouldn't give her a colonoscopy. She knew something was wrong and they were like, you're so young, you're so young. If one more person says you're so young, and like, it's just listen to your body, ask the questions, get to a doctor who will help you, because there's just so many people out there. I think you just trust that the doctors are going to know what to do. And you could go to the doctor and just sit there and be like, yep, and they're going to do exactly. No, you have to fight for yourself. And I was lucky enough to have some amazing, amazing doctors on my side who, quite frankly, I believe saved my life. And yeah, that's my story.
Yeah.
Well, it's an amazing story. Have you written it down somewhere?
I mean, we have
I've been telling her to write a book for years now.
We have so much of it documented on our YouTube channel because we were putting out videos during the whole thing. And like, it was honestly like kind of therapeutic for me and an easy way just to communicate with people too, because there was so much going on and it was so confusing that I would just do a video and then, people would. So it is kind of like documented a lot on our YouTube channel, but no, I haven't written it down and I probably should.
It's funny because I feel like in many ways we're two peas in a pod, even though we both, maybe our anxiety of things is different. But I feel the same way. Like, because I don't know what it's supposed to feel like to have my particular kind of cancer. And so I don't want to waste their time or resources and find out, well, it was nothing, And I had an appointment. I recently just flew on a plane to Disneyland, and I've been having a lot of pain in my ribs and taking a deep breath. And now they're worried that I have a pulmonary embolism or a blood clot. And the nurse practitioner said to me, no, in your case, we're worried that you're not going to come in. But I don't want to be the girl that cried wolf. You know what I mean?
Yeah. And that's exactly how it was. It's like, everyone kept saying like, oh, you probably pulled a muscle because you rode a bike or whatever it may be. But I was like, nope, I'm going in. And something in me. And also, if we hadn't gotten those bikes, I still believe that whatever I did on the bike, whether it was using, muscles I hadn't used, is what finally, as I like to say, caused my body to like raise the flags up and be like, hey, we're suffering in here. And it was so weird that Brian came home that day from church and was just like, I got to get a bike.
now.
And if I don't get it today, I'm never going to do it. And like, I just think about like what would have been if we hadn't gone down that path and how long it would have taken for the pain to finally flare up. And all that. But so 2 weeks after.
Yeah. Do you want to get to the thriving part? Here we go.
January 16th, 2023 is when I had that huge surgery, all this stuff taken out of my body. I was lucky enough that before we started chemo, I was able to do 2 rounds of egg retrieval because Brian and I, although we've been married forever, hadn't gotten quite to the children part of our story. We were just this close. We had plans in place. We were like, we're going to do this, we're going to do this, and then we're going to start trying to have a child. And then cancer kind of stepped in.
Derailed it and then advanced our timeline.
Because now we have the baby that end of the story. But anyway, so 2 weeks after that full hysterectomy, we drove home from Minnesota with me like laying on a mattress in the back of the car, like
air mattress,
and went and did an embryo transfer of one of our 3 embryos that we got from the egg retrieval. And my cousin, who is like the most amazing, I don't know if she's watching, but Tess, we love you. She had called me up like without me even asking very early on and was like, if you need someone to carry your baby, I'm your girl. Like, I'll do it. Like, okay. So we transferred the embryo to her. She carried our baby girl who was born in October of 2023.
Friday, October 13th. She got a lucky baby.
I mean, there's just so much remarkable things in this story. I encourage you to write it down. I have a title for you. A Bicycle Saved My Life.
Yeah. Well, and the other crazy thing is like, so in the back and forth that I was going through with, is she going to have surgery? Is she not going to have surgery? The initial surgeon I was assigned to flat out told me, because he thinks I'm like stage 4 and it's already spread to my liver and everything like that. He's like, I would focus on yourself right now and not worry about like having children. Basically told us not to do the embryo transfer because we're like, we have this embryo transfer scheduled for February 1st already. So we're doing that. And he's just like, yeah, I would just focus on you for now and not do that. And we were like, yeah, okay.
Like, yeah, we're not going to do that.
We told that to the surgeon who did do my surgery eventually. And she was like, or we told her like about it and she was all for it. She's like, yeah, like go for it. And that's what cancer
Any
does
reason
to you.
that you can have to fight to stay alive.
That's what cancer does to you. It's like, no, I'm not going to wait. I'm not going to wait anymore. We've waited so long to have children. We've waited so long to do all these things. And then when we announced that we were having a child, people were like, oh, she's going to be motherless and all this kind of crazy stuff.
We still have people that comment
because I'm going to die of cancer or whatever, and then leave her without a mother. And it's like, hello, nobody's guaranteed anything in life. Nothing is guaranteed whether I have cancer or not. Like I could step out and, die some other way. Like there's this false sense of security that you have in your brain. In my brain, my entire life, I'm like, oh, I'll probably live to be at least like 80 or something or whatever. And all that is just a joke because in one moment, it could all be taken away, whether it's through cancer or something else. And so I think when you go through something as traumatic as a cancer diagnosis, it just frees you. And I feel honestly lucky that it happened to me at 36. And that potentially I can live the rest of my life with this newfound filter that I have. It's like this new, I've just, everything's just changed so much in my life. Yeah. And I see everything so differently because of the cancer diagnosis.
Totally.
Well, I think you appreciate things so much more.
Oh yeah. You do. Everything means so much more. Spending time with friends and family means so much more. But then all the stupid things that meant, that were such a big deal before just don't matter anymore. And you'll be sitting there and hearing people having conversations, and you overhear a conversation that people are having and you're like, wow, what a dumb thing to be worried about. Like,
yep.
In the scheme of the world. I see Bailey.
I know. Well, that's what I was thinking. All I want to do now is pet my dog.
Right?
It's like that's the
So,
most important thing on my schedule these days.
so then we have a baby and everything's great, and then tie a bow, and now we're happy and everything's wonderful.
And we all lived happily ever after. Yay!
Until dun da 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 da.
So yeah, my story actually started just a bit before uh, before Elsie was born in July of what year was that? Was
2022?
Three.
Three?
Would have been 2023.
Oh, okay.
July of 2023. I got really sick over 4th of July weekend to my stomach, like really, really sick. And I never, like, I got better, but I still felt weird. My stomach still felt weird. I was still having like quite a bit of gas and stuff too. And it was like way long after that I'd been sick. And so I'm like, okay, like we got this whole thing coming up. We actually ended up moving to Columbus, Ohio for a little bit, like a month before Elsie was born and a month after. And
That's where my cousin who carried her lives. So
and so I contacted my doctor, and he was like, yeah, it's like we'll come in, chat with you, blah blah blah. So I went to him, and he goes, okay, let's put you in touch with a gastroenterologist. And then I think the first scheduled meeting that I could have gotten, we were in Columbus at the time, and I was like, okay, I'm gonna have to push this back. So I pushed it back until later, and we ended up going and seeing him, and he's like, okay, let's do an upper endoscopy and let's do a colonoscopy. It's like, you're 40, let's just go ahead and get this stuff like knocked out, at that age.
So he gets it scheduled. The day he gets it scheduled for is the day that I am scheduled to return to work after my maternity leave, which I'm very fortunate that my company gives me 6 months of maternity leave. But it was April 13th or 12th or 13th. I can't remember what day it was, but yeah, that's the day he schedules his colonoscopy and upper endoscopy for. And I'm like, Brian, what are you doing?
I didn't know at the time that was the case. And it's just when he told me that was the schedule, that's what I went with. So I go there. I get because they're just trying to figure out what's wrong, why I'm having these issues, of which like my issues had lessened and lessened and lessened throughout the time. And so I go there, they do the upper endoscopy, they do the colonoscopy. The gastroenterologist said I was the toughest colonoscopy he'd ever done, and it actually didn't get completed. They did about 3/4 of it, and they couldn't get past a certain spot where there was an inflammatory polyp and all that. And so they wake me up, they're like, well, the rest of it looks pretty good and blah, blah, blah. Go home, have fun, right? So I go home, and in the middle of the night, I woke up in severe pain, worst pain I've ever had. And it's like just right across like the top of my like where my stomach is and all that. And I was like, oh, this is really, really bad. And so I sat there for several hours, just sort of trying to get like, maybe it's just really bad gas or something like that. Like I did just have a colonoscopy, blah, blah, blah. And in the morning, Jessica's like, do you need to go to the ER? I'm like,
like, we're going
maybe. And then finally, like I did something and it hurt really bad. And I was like, okay, we need to go to the ER, because this is not going away. It's not getting any better after painkillers or anything of the sort. So we go to the ER, and they find out that when I got the colonoscopy, my colon didn't wake back up again. And so I had stuff in my colon. It wasn't doing anything. It was just sitting there, not moving, and causing me a massive amount of pain. And so they did a CT scan, though, to find out if that was actually the case. And they come in and they're like, yep, your colon went to sleep. We're going to give you this stuff, this one drug. It'll wake it back up again. It's like you'll be fine in a day or so. We'll keep you monitored. Also, we found a mass on your kidney.
Uh-oh.
And they sent up the ER like doctor was like, it's gonna be fine. Like this stuff happens. They'll just go in, remove it. You'll be good. Not a big deal at all. Then the who I forgot what the actual title is. She was an oncologist. And she comes up to my room and she goes, "Yep. So there's a mass on your kidney. A 90% chance it's cancer." And I looked at Jessica and I laughed because I was like, you've got to be kidding me. Like seriously,
no, there's no way. Like that's just not.
Like this is as people have said, if we didn't have bad luck, we'd have no luck at all. But I laughed and was like, this is just
I think
unreal.
That was probably the weirdest reaction to being told that you probably have cancer that she had experienced. It was like we were both just like,
yeah, at that point, like,
I mean, what more can you give us?
We're not surprised by
oh my God. I when I saw that, you know, what your thumbnail was, do I have cancer? I'm like, I mean, it was like, it's really unbelievable, you know?
Well, and honestly, like there were some comments in that was like, oh, this is clickbait. And I'm like, no, this is like not even like we hate doing anything that's even remotely clickbaity. And it was like, no, this is just literally our lives. Our lives are just that like messed up.
Yeah. So so after that, like I get out of the hospital and everything. Jessica goes, like, I'm calling Mayo Clinic.
Yeah,
now.
Monday morning, I was like,
she called him up.
I'm like, if they're gonna take your kid, because they explained to us that you probably would either need to have part or all of one of his kidneys removed,
a partial or a radical nephrectomy.
And I was just like, I'm calling Mayo Clinic. So I called them. It was like a Monday morning, and we were like on our way up there like later that week for appointments.
Yeah,
like they got everything
and they did a biopsy of the tumor to 100% determine that it was cancer. And then like the following week, I was in surgery getting my kidney removed, and then recovery after that. I eventually did meet with an actual oncologist, and apparently the kidney oncology department is full of people that are interesting, because my oncologist, he's just a goofy dude and I really like him. He's just funny. He's got like he's got like Kramer energy, like Kramer from Seinfeld. He's just sort of like a little bit off, but he's also from like South America, so he has an accent, and he just
but he just like bursts into the room. Like it's just like
he doesn't have like a person come out and like take you back. He just comes out himself, like and just like, Mr. Krock, let's go.
Yeah, he'll come to the waiting room and just like, come on.
Like, and I've mentioned him to like other doctors, and they're just like, oh yeah, that's just who he is. But like the first time we met with him, you know, he was talking about you know, possible treatment plans and stuff like that. And even when we met with the first oncologist after I was in the ER, because I asked like, so what's the deal here? Like, do I get post-op treatment or whatever? Do I get chemo? Do I get radiation? Whatever? And they go, nope, we don't do chemo and radiation for kidney cancer, because it grows like so slowly, right? It's not as effective with those treatments. But what they did do was they offered if I wanted to take immunotherapy. So they wanted to give me Keytruda, which I know that's one of the options that you have.
That's what I'm starting on February 6th. Yeah.
Oh, okay, cool. So the oncologist explained to me that because I was technically stage 3 for kidney cancer. I didn't mention like that at all before. So I was technically stage 3 because it had just pushed through the kidney wall and was sitting next to the fat, and so that technically made it stage 3. If it had been caught probably a few months before or like a year before, it would have been stage 1. So, you know, that's just how those things work. But he told me, yep, you can do Keytruda. He's like, here's the percentage, like in 5-year survival rates of like, this is what it increases. He goes, but also it only got approved 5 years ago, for kidney cancer. Yeah. So therefore there is only 5 years of information, which is one generation of kidney cancer survivors.
Yeah, there's just not a lot of like research on kidney cancer out there yet. Like, I mean, there's research, but not like, I don't know. It's just
and kidney cancer is kind of a really, it's a weird sort of cancer to have, because like stages 1 through 3, the survival rate is really good, and stage 4 is really bad. Like it drops from like, you know, it's like 70+% to like 10 to 15% 5-year survival rate, like just with that step alone.
Do you remember the percent? So the Keytruda for him would be like to prevent it from reoccurring.
Yes.
Because they believe that they got clear margins. They cut out the tumor. It
Yes.
was like they believe
there was nothing in my renal vein.
Nothing, yeah, there was
Like,
nothing left in there.
The surgery could not have honestly been better, like for like a good report, really. Because yeah, there were clear margins, there was nothing in the renal vein, and there was nothing in the lymph nodes. So that was really, really good to have.
But do you remember what the percentage was? It like,
it was like 5%.
It was like
increase.
a 5% increase in the chance that it doesn't like reoccur if he does the Keytruda.
Yeah.
But
and he said that like for like other forms of cancer, if they can increase that chance of survival by 1%, they do it. He goes, but for kidney cancer, it's not really like a vast increase, technically speaking. But the other thing that he said was that if it does spread, they can use Keytruda in combination with a targeted therapy. And he said, and it's just been approved like just a bit ago, like a year ago or so. And he said, we are seeing great success with this. He goes, we've given these 2 drugs to people and then gone in for surgery and all of the cancer's dead. Like it's rather amazing. He goes, so we can give you Keytruda now, and then it might not be as effective later on, or you can not do Keytruda, and then if it does spread, we can give you these two drugs, or Keytruda and this other drug, and it's a lot more effective at treating this. He goes, but they will only give you that other drug if it's stage 4, because it costs like $30,000 a pill or something, like or an infusion or whatever it is.
Yeah, I just figured out why they give up cancer patients so much free stuff is because the treatment is ridiculously expensive.
Yeah. Also, if anybody's actually going through that kind of thing, like try to find as many free things as you can possibly get. Trust me, it makes life a lot more fun because you feel a little bit more special that you're getting the free stuff, the free swag or whatever it happens to be.
I got 3 free wigs.
Nice.
Yeah.
So so it's basically like, okay, we can attack this. So we don't know if it's going to reoccur. There's no sign that it's not reoccurring right now. We can do the Keytruda and maybe it will help 5%, chance that it might not reoccur. Or once it does reoccur, if it does, we have a really strong like attack plan with the Keytruda combined with this other drug to go after it.
Yep.
So ultimately we discussed it and it was just like,
I decided not to do Keytruda at this current stage.
Yeah.
But I did hear from a lot of people that are fans of ours, and they commented or sent me messages and were basically like, they had a lot of really good things to say about Keytruda and its effectiveness. And honestly, immunotherapies and targeted therapies like are an incredibly cool and powerful tool that they have in cancer treatment now, and it's only getting better. It's only getting more powerful, and better treatments are starting to come along, and then there's even, because I keep up on all the cancer treatment stuff now, like there are some treatments that they are developing now that are just amazing, like in the realm of science fiction level cool, when it comes to treatments and stuff. So like it is quite possible though that like the generation that is born now will be the last generation to see people dying from cancer. Like that is entirely within possibility now. And that's an amazing thought.
Yeah, unbelievable. Hey,
well, I would say, I think that.
Oh, I did want to say one final thing too. So when we met with my oncologist, Jessica asked the question. So what do you think Brian's, what was the word that you used?
Like
prospects.
Prospects.
Like what do you think his prospects are as far as like future goes and stuff like that? And my oncologist goes, I think he's cured. And I'm like, wait, is he allowed to say that? Is he? Because I've never heard an oncologist say the word cured, or yes, we can cure that. They go, this treatment is curative,
Yeah.
but it doesn't necessarily mean, like, they're very, very stingy with the word cured.
Yeah, but
And
he
so
felt
he was
that
just like, he
strongly.
felt that strongly
Yeah.
just from seeing my case, seeing what the surgery revealed, seeing my scans. He's like, I think we got everything out of you. He goes, I think you're good.
So now we're both on the every 3 to 4 months we get scans. So we've been trying to like sync up our scan schedules because
we finally got it.
We're both going up to Mayo Clinic for it. And so it's like we drive up there and go. So we finally have them on synced together. So our next checkups will be in March. But then there was a whole thing of Brian might have Crohn's disease. Like it's a whole thing.
So Mayo also redid I got in with their gastroenterology department, and they redid the colonoscopy, which, having 2 colonoscopies like within a year is just not fun.
Which, by the way,
it is such a brutal process.
I did. Oh my God. That's my biggest fear is anesthesia. I did the colonoscopy. Listen to this. I did the endoscopy and I did the core needle biopsy all without sedation. I got like a medal from Sutter because nobody.
You are insane.
Yeah. When they did the biopsy with me for my kidney, they asked if I wanted to be put under, and I was like, no, like this is way too cool to miss.
When they did anything,
I asked if I could do it for the colonoscopy, and they were like, no, we're gonna put you under. And I was like,
it's so fun. It actually is kind of fun to watch,
They offer me anything, I'm like, give it to me, please. Knock me out.
Jessica's like, give me the drugs.
No,
that's how I am with dentistry. But yeah, before I forget, I got to thank you, Jessica, for referring me to Dr. Dawn Musalem, because it took me a year and a half to get an oncologist. So I booked her privately, and she was wonderful. She's been on the show twice. She's a very inspirational person. If you haven't seen her, cancer survivor, heart transplant survivor, marathoner now. And she's the one that told me about this thing called a liquid biopsy. So I, before I could get the needle biopsy, I had proof. And it's funny that they don't accept that, even though it said exactly the same thing that the tissue said. But they need the tissue to do the genetic testing, though, know?
But the crazy part is there's so many things that I'll just be having a conversation with my doctors, and I'll say, well, can we do this? Can we do that? Can we do this? Can we do that? Why don't we do this? And they'll add things, so don't expect, I guess, for people out there, don't expect them to always, that's why it's like having him he's reading studies, he's doing research. Like, don't expect them to always come to the plate with everything. Like, their brain is just like, here's the standard way we're going to treat it. But if you ask questions, sometimes that might lead to something like you said, with the liquid biopsy, you might not have, like gotten to that point if you hadn't had the right conversations. Let's see, what was I going to say to you? I was going to say, so basically I just want everybody to know we're both kind of like no evidence of disease is kind of what we consider ourselves. And we just go for our scans every few months and hope that nothing comes up. And I stay awake at night a lot of times thinking about like, will both of us have this? Like, what are the odds that neither of us have it come back? Like, that's got to be low. Like, one of us has got to be like, but it's not it is in a joking way a lot of times, because it's like, well, who's going to bite the bullet? Like, who's going to, or who's going to,
I'm living to 80. I don't care.
Who's going to get knocked out first? It's like, you just have to joke about it sometimes.
Cancer or not, I'm living to 80.
But yes, I feel like we have like so much more we could talk about with you with cancer and everything. Like, there's so many aspects.
I want to respect your time, but can you come back? Because I'm not going to do a live show every day, but maybe you guys can come back either once a month or every few months. I'm going to be doing a series starting next month called Thrivers Thursday, because there's so much I still want to talk to you about like what you did, if you did anything emotionally or because there's so much more to talk about with you. Were you offered radiation, Jessica, or that wasn't part of it?
No, it never got to that point. So when I went into that second surgery, they were just trying to find tissue to see like, okay, what has the cancer evolved into? They had the cancerous tissue from my first surgery that was done in my hospital at home, but it was like, okay, let's see because cancer is constantly changing, right? So it's like, what is the next plan of attack? But when they found absolutely nothing, it was like, oh, okay, there is. So, those things would have maybe been on the docket. Like if we'd gotten to that point, but it was like, oh, okay, well, there's nothing left in there that's cancer. So let's just stop treatment altogether. And then kind of now we're just in that wait and see, bucket, which is a weird space to be in. But yeah, there's so much more we can talk about. I would love to talk about on a future one, maybe talking about like, because we've both been the caregiver and also both been the cancer patient. Like we have that weird, there's so much there we could
your
talk
story
about.
is just, every part of your story is amazing on so many levels. So
there's so much that Brian, I feel like, and we just started, we've taken quite the break from posting on our YouTube channel, but we're back at it. We've already filmed like several videos ahead now. So we will be posting on a regular basis, usually on Sundays. But there's so much I feel like Brian still needs to talk about based on what he's gone through, because although he is the one that doesn't have anxiety, et cetera, whatever, this has brought on some panic attacks for him. And so there's just so much more that we could definitely talk to you about for sure. So
I would love to
come back.
It would be an honor to have you back, because and I can talk about panic too. Well, thank you guys so much. Love you both so much. And I think that you are doing just such an amazing thing, telling people what's going on, because we shouldn't have to hide,
Yeah, for sure.
It's just a statement of fact. I always tell people that, and even when it comes to things like weight loss, where people are like, oh, I never want to set foot on a scale or anything. I'm just like, I tell them like this, it's just a fact. That's all it is. It's just a fact. You don't have to give it emotional power or anything over your life. So we want to talk about, what it's like to go through cancer, what it's like to go through chemo and all of that kind of stuff. Like we absolutely can have that conversation, be completely candid about it, because yes, it's weird and it's traumatic, but at the same time, it's the same story that's being told time and time again by thousands upon thousands of people every day, every year, millions of people around the world. Like it is sadly not an entirely unique story, and people need to hear that. People need to understand that yes, we're going through all of this, but we're kind of all in the same boat together. It's like I said before, that now we're all in the exclusive cancer club, and that's, sometimes you just got to think about it that way. It's like, oh, we're in that little club together. Hi, Miss Elsie.
Look how cute she is. Look what you got out of this, though. It's an amazing.
She was worth every bit of it. Every bit of pain, every bit of suffering, every bit of trauma. She is joy incarnate.
I'm out of breath now. I ran downstairs to get her.
She is sunshine, rainbows.
He is precious. I have one more quick question before I let you go.
Yes.
What message of hope would you give to somebody currently facing a cancer diagnosis?
Do you want to go first?
No, you go
first. I can go. What message of hope do I want to give to people? Do not go quietly into that good night. Rage. I always tell people this, that like I am, and I know she's going to say the exact same thing. There is always something to be happy about. There is always something to find joy in. There is always something that can connect you to other people, and understand that, like I said just a bit ago, like none of us are alone in any of this. It may feel like it, but none of us are alone. So stay strong and keep plugging forward. Keep doing what you're doing. Keep living your life. Like never ever just stop living your life.
My message of hope is Elsie. Because if I hadn't gotten cancer, I wouldn't have Elsie. Like we might have a child, but that egg that was retrieved after I found out, like literally a few weeks after I found out I had cancer, that, became the embryo that became Elsie, like no other combination of events in my life would have led to this. So if you're in the deepest, darkest, like time of your life, you just keep hope that it will lead to something beautiful. And that's what kept us going and keeps us going. Like she is literally the light of our lives. And, whether it's her or something else that you may lead to in your life, like don't see a cancer diagnosis as like a death sentence
It's not.
or a, you know, oh, well, now that I have cancer, like everything is going to suck going here forward. But just try to pick out the joy that can come along with it. And I know that, you know, AJ, you've been experiencing some of that joy that can come along with it. And this enlightened, you feel like you know a secret that like nobody else knows, and you want to spread that secret with everybody.
Absolutely. I don't feel like it's a death sentence. It's an opportunity to live.
Yes.
Guys, thank you. I look forward to having you back as soon as possible. This was wonderful. Thank you, Krocks. And thanks all of you for watching day 26 of Thriving in the Face of Cancer. We all want you to know that wherever you are in your cancer journey, as long as you're still breathing, we believe there's still hope and that you too can thrive even in the face of cancer. Please tune in tomorrow for day 27 with Dr. Brooke.